When I think about European biological medicine and all your impact, I also want to go back to your understanding that you too were a conventional doctor first. What was that story that led you into becoming this pioneer in European and Swiss biological medicine?
Well, I was educated as a normal doctor. I did the final examination. Well, I even had the final examination in the US.
Oh.
And because I studied there too. And so then I became a rheumatologist for internal medicine. We call it specialization rheumatologist. And this I would say gave the key to my development afterwards, because my patients, I was leading, this was really a gift of God, that in young age, I was entitled to lead a big kurhaus with many beds and they were doing rehabilitation. And so we had all these with rheumatoid arthritis, this kind of patients, or lupus, or sclerodermia, or all these difficult things. And honestly, they came 3 weeks, they got better. Well, of course, because they got steroids, But then, in fact, they did not really get better. And so I had patients who came, especially I remember one, she said, "Oh, Dr. Rao, you're a wonderful doctor, but, now I finally got better." Well, good. So, then I asked the question, which normally doctors don't ask, but what did you do?
Mm-hmm.
And she said, "Oh, I went to this doctor and he found that I was hyperacidity problem, and so that my nutrition was wrong." And so, what? You have rheumatoid arthritis? No, I had rheumatoid arthritis, but this was due to my hyperacidity of the body. And so I went to detoxify and to alkalize the body. What alkalinization? What is this? And where did you go? This was the next question. Nobody asks me now. My patients, where did you go? She said, "Oh, to Dr. Wertmann in Salzburg." And he is the one who, well, then I took the phone. "Can you, colleague, we have a mutual patient. You helped her so much. What did you do?" And this colleague was very amazed that somebody calls and somebody asks what he does. And then I asked, "Well, would it be possible that I visit, like your father visited me?" So this is very rare. And so I learned, like apprenticeship. And during at least 20 years, my wife and myself, we spent our holidays and we went to all these biomedicine popes. And we learned, because you can't learn these techniques. It's like your father went to Paris and had a very, very important mind change there.
Yes.
And so I had my mind changers, and this is,
Do you think that's part of the problem in medicine right now, is that you don't have such a curiosity in conventional medicine? It almost seems that when a doctor goes through training, that's it. They've learned all they can. And they stop and they go to continuing medical education, but very much so in what they've already learned. Whereas I see doctors and I think, why aren't they going out into the world and doing what you did, what my father did, and finding more apprenticeship?
Yeah, that's really a problem. Doctors now, even the students, well, at least in Europe, there is a selection technique so that you select repetitive individuals and not questioning individuals. So that's a very big difference. And so then they get taught what they have to say, guidelines. They have to follow the guidelines. They learn 6 years in university, they learn to follow guidelines. And poor boy, if you don't follow the guidelines, you fall out of our society. So, well, I know it's a little bit cynic what I say, but what a doctor, a real doctor, a health person would need is questioning, finding, individualization. So I always say, I never treat diagnoses. I always treat human beings.
Yeah. No, it's a beautiful thing when you switch from diagnosis, which is just a word, a description, to actual human beings, to actually listening to humans, not just putting a label and saying that's what I'm treating. But it's so rare.